Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. I've had the privilege of knowing today's guests for over a decade as a colleague, mentor, and friend. Mr. Pete Breitinger has spent more than 30 years shaping the PA profession, not only through his work in pediatric cardiology in the UF Mobile Outreach Clinic, but also by guiding generations of students as an assistant professor at the University of Florida School of Physician Assistant Studies. In this conversation, Pete shares how a career that began with a love for wildlife conservation led him to medicine. He talks about the unexpected joy he found in pediatric cardiology and the lessons he's learned about resilience, both in the clinic, in the classroom, and in his personal life. We talk about patient advocacy in its truest form, the realities of healthcare inequity, and how some of the most important moments in medicine happen outside the exam room. At its heart, this is a conversation about the human side of healthcare, the part that shapes who we are as clinicians. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Pete Breitinger. Hey, Pete, thank you so much for joining us today on Shadow Me Next. This is such a gift to me because Pete is not only somebody that I've known and admired for such a long time, he is my mentor and was my mentor throughout PA school. So it's a treat for me to have you on the show. Thank you so much for joining us.
Thank you. I'm so honored to be here, and I'm so proud of you for doing this. But not only that, kudos for your graduation speech. That was so inspiring. It really was. And that's what makes me so happy as well, to see people who, PAs, right, who have been through the program and their success, that's really fulfilling. So proud of you.
I appreciate it. It was a group effort from the people I've spoken with on the podcast who are just, I invite them expecting them to be your typical average healthcare provider. And then we have this conversation and every single one of them is just mind-blowingly incredible and awesome. What we're doing is not just ending when we step out of those exam rooms. These people are doing incredible things and they contributed to, but it's a mark of what an incredible educator you are. The fact that you do follow your students, and you've been in PA education for a while. So you have seen a lot of students come through and really seen how they've shaped the landscape of this incredible profession that we have. You have had a long career as both a PA and a PA educator. How long have you been doing this? Tell us.
So my LinkedIn profile said, "Hey, congratulations for being at UF for 32 years." I'm like, whoa. So that's amazing. It's been an amazing journey, amazing ride, amazing career. And you hear this from PAs all the time. It's like, I picked the best profession to be in. And we most definitely have. It's been really cool to really kind of see students grow throughout the program, becoming PAs, but more importantly, following them through their careers to see the amazing stuff that people do, right? We have PAs who've invented stuff. We have PAs who are doing podcasts outside of the profession, but yet still kind of promoting the profession, which is really cool. I had a faculty member kind of tell me not too long ago, actually, which really kind of resonated with me. It's like, you spend this time educating students, and if you add up the amount of students that you've touched through education, right, and then you multiply that by the amount of patients they have seen, that's literally the amount of patients that you have indirectly kind of helped affect, or at least kind of understand and know about the PA profession. And it gets, when you've been in the profession for a while, it gets up in the millions, right?
I imagine a tree, and I imagine all the
Mhm.
branches of that tree. We've talked a lot about mentors on this show, and having a mentor is so important. And a lot of times it's not, I mean, good Lord knows I do not work in pediatric cardiology. I couldn't. I'm amazed with what you do with these sweet, tiniest, littlest of hearts. But you still mentor me, and I still ask you questions about all sorts of things related to the profession, not necessarily related to the medicine. And I think that's what is so interesting is a mentorship can look so vastly different as a
Mhm.
PA. Pete, go back more than 30 years. How did you know about the PA profession? It was rather new when you first entered it, wasn't it?
So it was, it's funny. I look back at my career, kind of where I went into medicine. I originally wanted to go into wildlife management. Okay. I was going to be like, I'm going to save the wolves, do whatever. Somehow along the way, I figured out there's really no career in wildlife management.
Mm-mm.
Um, and just kind of fell into actually going to Santa Fe for cardiovascular technology. I was a cardiovascular tech and worked cath lab, did echo, ultrasound, that kind of stuff. And then through there, I actually had some exposure to a couple PAs that I knew, one who actually was part of the program at the time. And she kind of encouraged me because, at the time looking at cardiovascular techs and, great profession, great people, but it's really about lateral movement. There wasn't really much in the variety, and I like variety. So,
Mm-hmm.
so anyway, so I kind of fell into PA and, been there ever since, obviously. As far as Peds Cardiology, that was kind of the similar. I initially started kind of going to work at the student infirmary, which is a great gig,
Mm-hmm.
and then came into education from there. And then I actually kind of have a good friend of mine who is a pediatric cardiologist here, who's a genius, kind of convinced me, hey, come on down, come on into Peds Cardiology. And it was such a great move because I never realized that that was actually kind of my passion as a PA, getting to know these patients, the
Mm-hmm.
families. But more importantly, it was probably my relationship with my supervising physician,
Mm.
who is my mentor and was fantastic with helping to kind of, really get me into the profession, into Pete's cardiology as well. So, and, it really led to a lot of wonderful experiences that as a PA, I never thought that I could have. I mean, I was really brought in to help with the echo lab, to help with the exercise program, but became so much more developing those relationships with the supervising physician and those patients and such too. It was great.
Pete, what? Because I'm sure, well, number one, I'm interested. It's a question I've never asked you, but I'm sure many people would be interested. What does a day look like for you? Just a typical regular day with these pediatric patients. I'm sure they're rather sick if they're seeing you. Is it always quite sad, or um, it seems like you enjoyed it? So I would imagine it's not always a hard day.
No, not necessarily. I was really more on the outpatient side of things. I never really kind of had the hospital responsibilities, which was fine because my comfort and my forte is really more clinic-based medicine.
Mm-hmm.
A typical day over there would be, we'd have conference in the morning, kind of go through surgical cases and patients, things like that. And then pretty much just kind of looking over your patients of the day, kind of seeing if there's any labs that are going to need to be done or any follow-ups and such like that, reading last notes, et cetera. And then, of course, clinic and just kind of running the patients with your supervising physician. Now, I also had the unique opportunity of helping develop their exercise program.
Oh.
So, scattered in there, I'd either be doing MVO2 stress tests or we'd be doing regular stress tests on patients. It kind of depended on the day. But, getting to know not only the patients, but the families themselves is one of the most fulfilling opportunities you can have as a provider and making those connections with those families. And there's still some families today that I'm still kind of connected to and watching the kids grow. seeing them from when they were first kind of a baby, having their surgeries and such, but yet following them, as teenagers and eventually into kind of adults, or helping them transition into that. That was big with us too, is transitioning our kids into, adult medicine as well. And, kind of following the adults over time too. Were there the sad moments and such? Because you do get incredibly close with these people. I've had several of adults who, or even some of our teenagers who have grown into adulthood and then passed away, arrhythmias, whatever. And that's hard. That's so tough. Just the joy. I mean, these kids are resilient. You talk about definition of resilience, go to Peds Cardiology, see these kids and the families themselves. I'm always impressed with, you know, since we're kind of a regional center, families from all walks of life. And I'm always impressed with those families who probably don't have two nickels to rub together, but yet their priority is their kid. They're still bringing them to clinics. They're still doing what they need to do. But not only that, the psychological side of coming to clinic is this the time they're going to tell me my daughter needs surgery? Or as an adult, is this the time when they're going to tell me, no, your heart's not getting any better. We're probably going to have to list you for transplant. You just kind of go through that, wondering when's the shoe going to drop, right?
That's a great example of how, you can have these great relationships with these patients and their families. And usually things are really, really good in your exam room. But for whatever reason, one day they walk in and they're just upset or angry or sour, not acting like they normally would. And there's just so many other fears that are underlying these conversations that we're having, the preconceived notions and the things that they're experiencing at home. And when you have these relationships with these patients, you will run into those things. It is a gift, I think, in medicine to be able to say, and it really is one of my favorite things to be able to say, hey, what's going on? This is not like you. This is not, you weren't like this the last 4 or 5 visits. Is everything okay? And then they will say no. And then they'll talk about something completely unrelated to your visit, but it contributes to their care. It's one more element that I don't think we talk about enough in clinical medicine, that it's so much more than looking at their diagnoses, than reviewing their medications and coming up with their plan. It's factoring in the rest of their life sometimes as well.
But that's what we are in medicine to do, right? I mean, that is the holistic side of medicine. And a lot of times that can actually be more the healing side of medicine, right? I mean, just the fact that you're listening and you're talking to them, they put so much trust in us, It is the other side of medicine that I would hate for see people kind of taking for granted, because that to me is kind of the fulfilling side as well.
It is. It's the human side, and it's the side that robots won't be able to replace, and the side that we can preserve. And also the side, Pete, that I would imagine, and I don't have to imagine, that I know that you talk to a lot of students about too, because you can read a textbook and you can learn about all of these conditions, but it is some of these human moments in medicine that it is nice to give students a glimpse into. You are a PA educator. You work for a university PA program. You have for a while. We've already mentioned you've seen a number of students come through. For you, what is the most rewarding thing about working in PA education, if you had to pick one?
I would say graduation, because if you think about it, it's a culmination of what they originally dreamed they wanted to do, till they got in there and realized, holy cow, this is tough, right? But to watch our students starting, first in the summer, have no clue, no clue, but to watch their growth into becoming a provider in 2 short years is amazing. And it just fills me so much. I mean, I tell my advisees, for better or for worse, I said, look, I expect you guys to really grow through this, and you're going to, and there's going to be some trials and tribulations, but you are going to come out the other end being a strong, beautiful, wonderful provider.
Yeah. It's incredible. Pete, so we've talked about your role in clinic in Peds Cardiology. What about as a PA educator? I would imagine it is a very, very different day for you, probably multifactorial, lots of things in the air that you're balancing. Still exciting though, I would imagine.
Exactly what you said, multiple balls in the air at any time. What students don't see, and they don't need to, it's like behind the curtain, Wizard of Oz kind of stuff. But there's a whole lot of administrative stuff that goes on that we all have to deal with. We are blessed with having a great faculty, great staff who are dedicated to the mission of the program, but more importantly, the mission of the students and ensuring that we're giving a good quality education. But yeah, from day to day, you just never know what fires are going to come up and what you need to kind of do. The best days are when you're in the classroom and you're not dealing with the emails that are coming in. I think that the other side that I really love about being here, obviously, is the variety, but it's also the creativity that it kind of can bring out in you, putting together lectures, putting together labs. It's a lot of work up front. But when you're up there and you're delivering content and you're seeing students are just kind of like, yeah, the light bulbs are going on, or you're throwing candy at them and they're happy, you know? Yeah, no, it's a highlight of education in a sense. But yeah, the behind the scenes stuff, it's a lot of administrative stuff, really is. But
it's almost like wearing two hats, which I mean, I think medicine's the same way. You're in the room with the patient, you're wearing your patient, I call it the customer service hat. And then you step back and you start charting and it's all the clerical work and it's just a little bit less, I smile less when I'm sitting at my computer as opposed to when I'm in front of my patients. I'd imagine the same students. So you mentioned, getting to really interact with these students and getting to see them pick up some of these incredible concepts that you have really worked so hard to present to them. In your opinion, when it comes to let's talk about the students for a second, for PA students specifically, what are some of the qualities that you consistently see in some of your most successful students? Let's not just talk didactic. Let's do didactic and clinical students. So just generally speaking, when you think about the most successful ones, what do they have? What's that thing?
I think the number one thing that I see in the most successful students, but really would love to see develop more so in all our students, is resilience.
Now, Pete and I did not get a chance to discuss the quality question, but this brings up an excellent opportunity to review a question that you might hear on a pre-health professional school interview. Describe a time in your life that helped you forge the most resilience. Listen in as Pete describes why this is so important in both our pre-health students and also our healthcare professionals. Keep in mind that there's more interview prep, such as mock interviews and personal statement review, over on shadowmenext.com. There you'll find amazing resources to help you as you prepare to answer your own quality questions.
Knowing when you get to a tough point, it's going to be okay. I just have to power through this, and then take that time to look back and go, okay, what was it that was giving me so much angst that I need to kind of improve in myself so that it's less and less next time these things kind of come up. And I guess, prime example, regardless of whether it's clinical or didactic, is, our students are highly motivated, highly successful, but yet they've never really felt the pain of maybe failing a test. So when that happens, it's almost world ending for them, and not that we're going to kick you out, but, I would hope that you're going to go back and go, okay, what was it that I didn't know so that now I know it for my patients later, right? Because we're not studying for the exams. Well, I mean, you got to get the grades, but we're studying for our patients ultimately, but having that resilience to realize, okay, we're still marching on, we're still doing what we want, still realizing our goals and our dream, and realizing also, and I think, the trust is a big thing. Trust the process, trust the program, trust where you're going and how we're taking you there. But more importantly, trust we're here to support you, because like I said, come graduation, I can't wait to call you colleague.
It's a special moment. And that's actually a perfect segue into another question that I wanted to ask, which was for students considering specifically for PAs. What is it that they should be doing now to best prepare? And of course, we know about the studying. They should be getting good grades. They should be getting clinical shadowing experience. But I'm wondering if what you might say in this case is put yourself in positions where you can develop resiliency and you can at least be able to speak on that a little bit. What is that what you would say? And if so, how could we do that?
That's a great question. I think it's kind of hard to really say, here's a cut plan for how you need to go about this, because, everyone has a different makeup of how they study and interpret things. But I would probably say if you are looking to get into PA school, start taking some harder classes, classes that are going to challenge you.
Mm.
So when you get into PA school, it's nonstop, right? We've all experienced it. We've all lived it, right? It is tiring. It'll wear you down. We used to have a director who would say, well, you all are in PA school. However, the cracks you may have bringing in, we didn't create them, but we're going to help widen them. Okay? So it's like, wow. But to some degree, unfortunately, it really challenges our mental health
Mm-hmm.
of who we are when you're going through this incredible stress time and time again. So I think the other thing that I usually kind of also tell, at least my advising the students, is, you know what? Yes, you guys are going to be under a lot of stress here. Don't forget who you are and practice your wellness. Get back to who you were before this and know that, again, we're here to support you. You're going to get through this.
And really, I guess, is again leads to a really interesting question. And you've been doing this for a long time, and I'm sure you've seen, plenty of difficult moments for students. But have you experienced any difficult moments in your career, whether it's in clinic and practice or perhaps in education, where you had to say, "Okay, let's get that putty out and let's fill up this crack real fast because this is rough right now."
I think we've all kind of gone through our periods of burnout and, it can be a cyclical event, right? I know that through education, yes, being in the PA education, I've had those moments of going through the burnout and questioning myself. Am I really cut out to be an educator? Am I really developing these students the way that they need to be developed? Because I mean, students obviously come in with their own expectations, right, of how things should be and how they
Right.
are. And there's been times when I felt like I just don't feel like I'm living up to those expectations. And it's bothered me. Challenges clinically, I would say probably my greatest challenge through my career was when my wife was diagnosed with breast cancer
Mm-hmm.
and becoming not only the caregiver, but also having that expectation that because I'm a PA, I'm going to know what to do throughout the course of what she was going through. I was fortunate that, yes, I have background in certain areas, but I don't have backgrounds in the areas where it's going to count the most for her right now, right?
Mm-hmm. Mm-hmm.
And to me, that kind of left me feeling, I don't want to say less as a PA, but it did kind of motivate and inspire me to make sure that, you know what, I am here to care for patients and I need to do the best that I can no matter what situation I'm in, you know? So.
Thank you so much for sharing that, because I think it's something that we don't talk about a lot is when we are put in those social situations, whether it's a spouse or a child or even a good friend.
Mm-hmm.
So many people will reach out to us in our private life and say, "Hey, what's your opinion on this?" And it might not be your specific field, but because you've been trained medically, they just want to know your opinion on that. And I think gosh, especially something that is so intimate as having a close family member walk through a long-term diagnosis like that. It can be eye-opening, I think. And it gives you an opportunity to be, you were definitely an advocate for your wife, of course, but I think it really reframes patient advocacy when you are the one that is so motivated to advocate for your spouse, for your child. How did that? Well, let me take a step back. Hey, we mentioned, of course, it's a buzzword. We mentioned patient advocacy. What does that mean, first of all?
I'm so happy you brought that up because that is something that's very important and near and dear to my heart and actually kind of form my opinion of what that looks like and what it should be while going through with my wife what she was going through, seeing her strength, seeing her resiliency, but more importantly, realizing our system's broken. Our system is rough, So when I'm with the students, especially now that they're new and such, one of my lectures is on the biopsychosocial. Okay. So it's kind of the whole, putting it all together, but yet, kind of empathy, all that stuff. Right. But one of the things that I ask them, and I ask every class this, and I have for a while, is what does PA stand for? And we get, physician assistant, we're associate now, right? And I go, well, yeah, that's our title, but what does it stand for? And they're like, patient advocate. because that is first and foremost your job as a PA is to help and make sure that that patient is getting through the system and they have the support they need. And that is your cure. That is what you are as a PA. Because, I mean, going through our own experience, I mean, we had some wonderful nurse navigators. I mean, oh my gosh, fantastic. But looking at some of these people who are going through this alone and not realizing, how do I need to kind of get, over here, or how do I need to kind of get into this office, or, what do I do if this happens, right? I don't know how those people do it without someone kind of being there to kind of advocate for them, you know? Now, granted, advocacy takes on many forms, right? The government political side of advocacy, super important, right? And if you're a person who is into that kind of grassroots kind of stuff, then yes, be a patient advocate in that direction. We need that as well, right? But most importantly, when you are in clinic, when you are with your patients, you are their advocate first and foremost. So I'm hoping that that kind of impresses on the students as they go out and we start to see this kind of building more and more.
It's true. Thank you for defining that for us, because I think it's a word that we so often hear thrown around and nobody really quite knows. Of course, like you said, the political grassroots efforts, things like that. But politics sometimes feels so far away from some people. And they think, well, I'm not cut out for patient advocacy. I don't want to lobby on Capitol Hill. That's not me. But that's not all it is. It's so much more intimate than that in certain situations, So thank you for defining that. Pete, as you have worked in PA education, you also had the opportunity to work on a mobile outreach clinic, which I'm sure gave you the opportunity to really see some of these biopsychosocial issues firsthand. Tell me about this outreach and tell me about why it is so important for PAs to seek out some of these opportunities that maybe are a little bit outside of their wheelhouse.
So if you want to be a true patient advocate, go work in underserved areas or rural health.
There you go. Yep.
That is, I mean, to me, that is just so inspiring. And the mobile outreach clinic is basically a bus that goes through Gainesville to provide care for underserved, non-insured patients. They have such a wonderful crew between the nurses, the NPs that are there, and the PAs. It's a really kind of cool interdisciplinary model as far as everyone kind of working together for the same shared goal, But they do it with such compassion, such love for the patients, and it's very much inspiring. I'm so grateful that we can have our students kind of going through that. In fact, if we could, I would say every single student should go through this, because not only does it kind of open your eyes to the health inequities that are out there, but it also opens your eyes and kind of helps influence you with social determinants of health and how powerful that plays within communities as far as determining population health and such, but also kind of helping students recognize resources within communities to help their patients, in addition to the fact that you're really practicing medicine without the benefit of having all the bells and whistles, right? So it's not like I know my patient needs an MRI. I can't just put the order in to say, schedule an MRI.
No.
I've got to find some other creative solutions to either try and get this person an MRI or at least get them to a point to where they're feeling more comfortable, right? Until we can, So you really have to kind of think about what you're doing and what you're able to do. So
I remember I did a rotation on the bus, and I 100% agree with you. It absolutely should be a required rotation for everybody, because you walk into this situation. This is my experience, but you walk into this situation knowing that you're going to be providing care to underserved, providing care to people with less. But Pete, I tell you, at no point while I was on the bus did I ever think, oh, this person is less. They just have less, and they have access to less. And I had to be more intentional with the care that I was giving and the prescriptions that I was writing, because it was just our access and their access and social determinants of health. These are things like transportation is a big one. A lot of these people can't get to the other side of town to come see the doctor. So the bus does that. Things like that. I think it is just, it is incredible. You've been working on the bus for a while. Go back to when you first started being a PA. How has your understanding of healthcare equity changed?
Oh, immensely. But I think though that has also been in general for everyone, right? I mean, I look back to when I started, yes, you knew the inequities were out there, but there weren't kind of programs in place to say, oh, you know what, let's start putting some clinics on the east side of town to get more people into the system per se. It's been a slowly kind of evolving process, obviously, and it's still not there. If you look particularly in our community, and I show this to the students, if you look at where the majority of ER and the standalone ERs are, they are all on the side of town where the money is, insurance is.
Wild.
So, I mean, just looking at a map alone, you see where the inequities lie, unfortunately. Being in education, though, it's also helped to better inform me as well.
True.
Throughout. In that respect, better informed students, too. I mean, our students are coming in more community aware and community responsive to what the needs are and being those advocates for that as well. So it's really cool to see.
That's incredible. It feels like the problems seem bigger, but the awareness is also bigger now, I think. And it's great. And I also think it's important, regardless of where you're practicing in medicine or how specialized your field is, or if you're ordering MRIs all the time, or if you're shopping off of the Walmart $7 list for prescriptions with your patients. I think everybody needs to have a general understanding of these things and of these problems. And I think that is something that we are doing so much better, at least recently, in education and healthcare education. So working our way there. What's one piece of advice that you like to give your students outside of medicine? Something that speaks to life or their character, not necessarily something that you would find in a textbook.
Oh, I'm not that wise.
I disagree.
Yeah, that's the golden rule, right? Just be kind, right? Be kind. You mentioned something before that resonated with me with the bus is when you see these patients, you don't see them as patients, right? Nor should you see anybody as a patient, right? Because they do. They have lives, behind what we're seeing, and they're going back to. I think if anything that for all of us is we need to recognize and maybe look beyond some of the biases that we have. Because, working on the MOC is not for everybody. Some people have those biases they can't get over. It's like, well, that's not your issue right now. Your issue is taking care of this person and looking beyond that to be able to objectively do that, right? So be kind. Just be kind.
That's fabulous. Pete, thank you so much for taking the time to join us on Shadow Me Next and just share your incredible journey and all of the people that you've impacted and the patients you've impacted. And I'm grateful for you. And it's a pleasure, of course, as always.
Well, I thank you as well. And I'm so proud of you and I'm very grateful of you and for what you're doing as well. So you are amazing.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.